In this video, I will discuss 4 tests within the Brockport fitness test: the flexed arm hang, the isometric push-up, the Apley scratch test, and the 1 mile walk run. This is the Brockport fitness test, flexed arm hang. The equipment needed for this is a pull-up bar. The subject will use an overhand grip. That is, the palms will be facing away from the body. Position the body with the arms flexed and the chin clearing the bar. The chest should be held close to the bar with legs hanging straight. The body must not swing, the knees must not be bent, and the legs must not kick. The subject holds this position for as long as possible. Only 1 trial is required. Subjects should be assisted to this position or utilize a bench or something else to get them into the position. For a student with visual impairment, it would be best to communicate with them and see what works best for them. Probably walking them up to where you're going to be doing the test, help them step up onto a bench, or have them reach overhead and grab the bar. Students should not be bending their knees or their legs, kicking, twisting, or anything like that that would finish the test. Many students will grab the bar with an underhand grip with the palms facing towards the body, but remind students to use an overhand grip where the palms face away from the body. It's also important that the chin clears the bar. Next up, the Brockport fitness test, isometric push-up. The subject assumes the standard starting position for a push-up. The hands are directly below the shoulders, the arms extended, the whole body in a straight line, and the toes touching the floor or a mat. The testing ends as soon as the subject is unable to maintain the correct position, or when the maximum time of 40 seconds has elapsed. Some incorrect positions you may see are bending the knees or the body in any way, sagging towards the floor, or swaying. Any of these would end the test. Next up, we have the Brockport fitness test, Apley scratch test. Whereas the first 2 tested muscular strength and endurance, this is a flexibility test. This test is performed in the standing position. The subject attempts to reach back with one hand and touch the superior medial angle of the opposite scapula. No rapid movement is allowed. They must be able to hold that position for 1 to 2 seconds. This is an assessment of the shoulder's abduction and external rotation. With the same hand, reach back and attempt to touch the inferior angle of the opposite scapula and hold that position for 1 to 2 seconds. This is an assessment of the shoulder's internal rotation and adduction. Test both the left and right shoulders. For the Brockport assessment, the scoring is between 0 and 3 and as follows. 3. Touch the superior medial angle of the opposite scapula. 2. Touch the top of the head. 1. Touch the mouth. 0. Unable to touch the mouth. Here are some movements that you may see that will disqualify the test. If they are trying to kill a bug that's on their back or exfoliate in the shower, it probably is a bit too much and is not allowed. The final test for this video is the 1 mile endurance run or walk test. The purpose of this test is to complete 1 mile in the fastest time possible. The participants begin running on the count ready, go. If they desire, walking may be interspersed with running. However, they should be encouraged to cover the distance in as short a time as possible. For younger children, a shorter test can be performed using the same procedures: a 1/4 mile for 6 to 7 years old, a 1/2 mile for 8 to 9 years old. For a student with a visual impairment, it would be useful to use a treadmill, as they can hold on to the sides or the front to have a sturdy gait. If outside, they could utilize a walking cane or another device such as a running buddy and things like that. This test is for aerobic endurance and can be done outdoors or indoors, depending on the student and depending on the situation. They may run or they may walk, but it is encouraged to finish the mile as quickly as possible.